marks the official it marks the official launch of our policy report, Improving Breast Cancer Care in the Middle East and Africa. Today, you learn about the key findings of this policy report, but also some of the recommendations that are mentioned in the report. And you also have the opportunity to follow an inspiring conversation about the report and its relevance for the region, and especially for women in the region. Before we start, I would like to remind everyone that we have simultaneous interpretation into Arabic for this session. If you wish to follow the session in Arabic, please choose the Arabic channel. The Arabic channel is it's a button on the bottom menu of the Zoom window. If you have any issues with that, if you need any support with that, please put your questions on the chat and we'll support you as much as we can. So for those of you who don't know IAPO, we are the global alliance representing patients of all nations across all disease areas, and we advocate for patient-centered healthcare. In 2022, IAPO started with the Personalized Cancer Care Alliance, and this is an alliance of patients, patient organizations, and carers in the region of the Eastern Mediterranean, but also some countries from Africa and Europe. And the main aim of this alliance was to advance health literacy in cancer, advocacy skills, and education on personalized cancer care. And with the work that we were doing, we quickly realized that breast cancer was a huge issue for this region, that we were focusing the activities of the Personalized Cancer Care Alliance. We understand, if you don't know, we understand that this was one of the main priorities that we should help to tackle. In this region, breast cancer care accounts to 1/3 of new cancer cases and almost 1/4 of cancer-related deaths among women. And these numbers, they are alarming. We understand there are a lot of efforts at country, regional, and global level happening at the moment to address this issue, and IAPO wanted to join forces and help advance breast cancer care. So over a year ago, IAPO commissioned the IHE, it's the Swedish Institute for Health Economics, to conduct a research and develop a policy report. And this is the policy report that we are launching today, Improving Breast Cancer Care in the Middle East and Africa. But of course, this region is huge, very diverse, more than almost 400 million people with very diverse economic, social, and cultural disparities. But we did understand that it has a challenge in common, and the challenge is the increasing breast cancer incidence. And to start our work, what we had to do, we had to choose where to start the research. And we decided to start this research in 9 countries: Algeria, Egypt, Israel, Jordan, Morocco, Saudi Arabia, South Africa, Turkey, and United Arab Emirates. We believe that these countries combined, they offer a comprehensive picture for us to better understand the challenges in the region, and more importantly, to help us offer recommendations of how to tackle these challenges. And this report, you see, we really hope to support policymakers in the region in decision-making and help them prioritize and improve breast cancer care initiatives. We also hope that the report offers an opportunity for the exchange of best practices and help for each country to learn from other countries' experience. And what makes this report unique? This report has it was a research, desk research conducted by the amazing team from IHE, but it also had 41 experts from all the 9 countries reviewing these research findings. So, and these experts, they represented different health stakeholders. We're talking about oncologists, health policies, experts, healthcare providers, payers, but more importantly, as importantly as these other stakeholders, it was also an opportunity to have the patient's perspective. So from each one of these countries, we also had the opportunity to have patients commenting these research findings, because we believe that the patient's lived experiences, they provide an invaluable insight that transcend any medical diagnosis. And they help foster a deep understanding of the multiple factors that influence health and well-being. And recognizing and incorporating these unique needs, perspectives, values from patients, it's vital for us to advance patient-centered healthcare and best breast cancer care, which is IAPO's mission. We want patients at the center of all health systems. But this report is also unique for another reason, because it was truly a collective effort. IAPO wasn't alone in this journey. As I've mentioned, we had 41 experts who supported the development of the report, but also we had IHE, who did the research itself, and we had a pool of 5 funders, sponsors to the work for the work to be possible. And I couldn't miss the opportunity to not only mention the name of the organizations involved, but also the name of the people involved in this process, because these organizations, they are made by people, and really important people. And we had an amazing experience in the process of developing this report. At the IHE, I couldn't thank Andrea Manzano Moore, Katarina Gralen, Nils Wilking, and Thomas Hofmacher, because they have been, it's been a true pleasure to work with them, and we learned so much from them. But also the sponsors. We had from AstraZeneca, Ezra, Jennifer, Wael, Viraj. From Lilly, we had Alexandra, MSD, Abby, Gertrude, Samar, Novartis, we had Marina, and Pfizer Sami. It was a great, immense pleasure to work with you all in this journey. So today marks the end of the research process, and it's a huge landmark for us to be able to launch the policy report, improving breast cancer in the Middle East and Africa. But it also marks the next phase of our journey, the phase where we are going to raise an awareness about the needs to address breast cancer care in the region, which is impacting so many women, but also to raise awareness about the need to increase investment in cancer care. It also marks the continuation of this journey, where we'll be advocating for all of this and supporting patient organizations on the ground to do so. And I'll talk about this more later on. Just a note, you can find the policy report on IAPO's website, but also IHE's website. and we'll share the link on the chat and after the webinar via email with you all. Without further ado, I would like to introduce the speakers who are with us here today. I have already mentioned Thomas Hofmarcher. He was the research lead from the Swedish Institute for Health Economics. We also have Dr. Sosan Almadi. She's an advocacy advisor from Align Efficient Health Consultancies. We have Dr. Reem Al-Jlouni, director of the Jordan Breast Cancer Program from the King Hussein Cancer Foundation from Jordan. And Ikram Ezehi, founder and president of Best Care for Breast Cancer Association in Morocco. And we have Giuseppe Troesi, technical officer of non-communicable diseases and mental health from the WHO Eastern Mediterranean region. Before we start the session and the discussions, I wanted to remind everyone, if you have any questions or comments, please put them on the chat and we will hopefully be able to address as many as possible when we get to the time of the Q&A. I would love to invite Thomas. He's going to provide an overview of the research, what has been done, what are the main findings, and also the recommendations. So this summary will lay the ground for the discussions that we'll have later on with our moderated panel discussion. Over to you, Thomas.
Thank you, Dani. What an amazing introduction you just made. And hello, everyone. 2 years of hard work and dedicated work are now finally over. And today we see the birth of our policy report. I am so happy and grateful for everyone joining us today and for everyone who has been with us in the past 2 years. And my task today is to give you an overview of the report findings. And for that purpose, I have prepared a couple of slides. But most importantly, I also want to say that this report is co-authored by my colleagues Andrea Manzano and Katarina Gralén at the Swedish Institute of Health Economics, as well as Niels Wilking, who is a medical oncologist at the Karolinska Institute in Stockholm. And let me start by showing you our beautiful front page of the report. So the report is called Improving Breast Cancer Care in the Middle East and Africa. It gives an overview of what is breast cancer and how good and in what way is breast cancer organized in a selected number of countries in the Middle East and Africa. And what we did, when you look at the chapters that you see here, we really tried to give a broad, holistic picture of the current situation, also relying on the structure of the WHO Global Breast Cancer Initiative and its 3 pillars of detection, diagnostics, and treatment. And methodology-wise, Dani has already mentioned this a little bit, so we're looking at 9 countries, and our report, the evidence, is based really on 2 primary sources. The first one is a targeted literature review, and we ended up with going through, I would say, thousands of documents, and 424 references have made it into the report. And there was one thing, because we are based, all of us are based in Sweden. But what we wanted to make sure is, of course, incorporate the local perspective. So equally important input to our research for this project was interviews with local experts. And we had the honor of interviewing and interacting with 41 local experts that you see listed here at the bottom right. And they're really representing different functions and roles that are important for improving breast cancer care. And I want to thank all of those 41 experts for their time and contribution. Thank you so much. And today the plan is to give you a little bit of a background on what is the disease and economic burden of breast cancer in the region, and how does the care process look like, and focusing especially on challenges that women encounter. And then I'll also have a slide with our main policy recommendations that we hope can improve the current situation. Let's start with the first one. Let's start with the disease and the economic burden of breast cancer. So breast cancer is already the leading cancer among women in the Middle East and Africa. It accounts for 34% of new cancer cases. In some countries, even as high as 43% of all cancer cases in women are only breast cancer. And it accounts for almost 1/4 of all cancer deaths in women. And again, in some countries, this might even be a bit higher. What we also see and what we show in the report is that the incidence is rising. It's continuing to rise. It has been rising for the past few decades, and it's predicted to continue to rise due to mainly population aging and population growth, but also due to unfavorable developments in some of the major risk factors of breast cancer, most importantly, overweight and obesity. So it's really a big challenge that countries are already facing now, but the challenge will continue to grow in the foreseeable future, which is why it is so important to tackle breast cancer now. And there's also an economic burden of breast cancer. And the economic burden is not just limited to our healthcare system. Of course, there's an economic burden from the treatment costs, but there's actually also a societal cost that we should consider, because many times women in this region who get breast cancer are in their prime working age. And getting the devastating news of having breast cancer, having to leave the workforce, means a loss of income for her, for the patient, and for her family. But all of this adds up for the economy as well, the loss of income, the loss of productivity. So what we see across the region, there are actually huge costs of what we call indirect costs that are non-healthcare costs. And another important thing when it comes to the economic burden is that we see that early detection is crucial, not just to save lives, but actually also to save money, because it is based on evidence that we see here from both Jordan and Saudi Arabia. Treating a patient diagnosed with stage 4 breast cancer, so metastatic breast cancer, is around 2 to 5 times more expensive than treating a patient that is diagnosed very early with stage 1 breast cancer. So there are economic gains in addition to the much higher survival chances from detecting early, which could generate savings that we would definitely need in order to enhance the quality of care that patients can receive. And now I would like to talk a little bit about the care process and challenges that women encounter during this process. And I'm following here in the picture that you see really the 3 pillars of the WHO Global Breast Cancer Initiative. So it's about detection, it's about the diagnostic process and treatment. But what we also did in the report was to make sure that, or to remind ourselves and our readers, that all of these pillars are actually connected through the organization of cancer care. They're the ones that hold everything together. And it's important to realize that patients have to navigate across these 3 pillars, which is a major challenge in many countries. And an underlying challenge for all of this and for all of the efforts that are being made is actually the basic structure of the healthcare system. So who has health coverage and who has not yet health coverage? And what is the governance of breast cancer? Are there initiatives in place? Is it really prioritized by local governments? But let me talk a little bit about the main challenges. So when it comes to the very first pillar, the detection of breast cancer, again, we would like to detect breast cancer as early as possible, because then the survival chances are the highest. In stage 1, they're almost 100% the survival chances, whereas in stage 4, they're less than 30%. Unfortunately, we see that a large proportion of breast cancer cases are detected late in the region. There have been improvements, but unfortunately, there are still, most of the times, more than 60% of cases that are not yet diagnosed in stage 1 or 2, which would be the aim of the WHO Global Breast Cancer Initiative. And the question is why? Why are we still diagnosing so many women late? Well, it's partly because of health literacy gaps. So it's really understanding that the symptoms that I experience are serious and I should get a medical appointment to get a checkup. But there might also be obstacles that hinder women from making a medical appointment, such as really the fear of being diagnosed of breast cancer, and also fearing the social stigma that a woman might face once she is diagnosed with breast cancer, as well as the socioeconomic consequences for herself, for her family, for her daughters, and so on. We also see an absence of a non-organized screening program. So this is also something that would help to detect more cases earlier, but that's something that is not in place on a countrywide basis in most of the countries that we looked at. So it's not, unfortunately, not yet the case that a woman would get an SMS or a WhatsApp message telling her, now it's time to go to your biannual screening and you should come to clinic A on this date at this time. And if this time doesn't fit you, you can rebook and schedule another visit. Unfortunately, we don't see that happening. We also see a very limited implementation of genetic risk assessment because there is this genetic element as well in breast cancer. And there are few countries that have actually started to address this, which would help women to be aware of their underlying risk to get breast cancer. In the diagnostic process, the second pillar, we see long delays in the diagnostic process. So it takes a very long time from the initial medical appointment until the initiation of treatment. And we also see a lack of a comprehensive assessment prior to treatment starts. So many times countries fail to reach the WHO aim of completing the diagnostic process within 60 days. And why is that? Well, partly because of a lack of patient navigation. So some patients are getting lost in the system, which delays the process. There's restricted accessibility to diagnostic services. So that includes imaging analysis, that includes pathological biomarker analysis. And that's partly due to an absence of infrastructure, so the machines, the equipment that is needed, but also absence of human resources, so absence of pathologists and imaging radiologists who are responsible to guide women through this process. And we also see a lack of reimbursement of novel biomarkers and gene expression profiling tests that would help to make sure that women can receive the latest treatment options and really make sure that we are targeting the kind of treatment that patients should receive according to their breast cancer subtype. Because even though I'm only talking about breast cancer here in this talk, we're actually talking about treating different subtypes of breast cancer: the hormone receptor positive breast cancer, the HER2 positive breast cancer, the triple negative breast cancer, and so on. And when it comes to the last pillar, treatment, we see limited access to multimodal treatment, so to surgery, to radiation therapy, to cancer medicines, and lack of access to novel treatment options. Although there are huge disparities across the regions, in some countries this is much better. Also for some population groups in a certain country, it might be better than for others. And we also see an uneven adoption of multidisciplinary team meetings and also a neglect of psychosocial needs for the patients during the treatment process, actually also during the diagnostic process. And part of the limited access is again explained by a lack of oncologists, so breast surgeons, radiologists, medical oncologists, restricted access to radiation therapy equipment, and also restricted access to modern cancer medicines. So you see, there are many challenges, but we also, together with the local experts, have developed lots of recommendations individually for each country. On this slide, I'm just showing you the broad picture, what are really the overall recommendations. And we have 5 overall recommendations. Recommendations number 1 is to strengthen the governance of breast cancer care. I think an excellent example is Egypt with the Presidential Initiative on Women's Health, which really made a huge impact on the country and put the spotlight on breast cancer and aligned, I think, all local efforts in improving breast cancer care. The second recommendations is improving the health literacy of women and also men on breast cancer. And raising awareness has been done a lot and also successfully in many countries, but there is still a gap between having the basic knowledge and actually using that knowledge to realize how it is important to go to it, or why it is important to go to a screening or to go to a medical checkup once you notice symptoms. And awareness campaigns such as when the Burj Khalifa, the highest building in the world, was light up in pink 2 years ago during Breast Cancer Awareness Month in October. I think that's a very nice way to raise awareness about breast cancer. The third recommendation is about optimizing the organization and delivery of care, because this is really where we see many obstacles that women are facing that lead to delays and the administration of non-optimal treatment. I think the implementation of uniform countrywide guidelines in Algeria that we have seen recently for breast cancer, that's an excellent example that other countries could follow in the region. Investment in human resources and infrastructure is equally important, because the number of breast cancer patients is growing, which means also that the number of physicians, nurses, and also the infrastructure probably needs to grow. We have seen successful efforts in training more and more medical oncologists, for instance, in Morocco, but more is needed. And finally, our final recommendation, the fifth one, is to adopt innovative diagnostic and treatment approaches. We have seen this already in the UAE happening with the use of AI-supported imaging analysis of breast cancer images. I think this is really the future, and more AI will help us to rationalize the use of our resources and help more women in an accurate and precise manner. So this was a quick overview of the entire report. As Dani said, you can already now actually download the report on our website, on IAPO's website. We will send you the link to the report also after this meeting. And what I want to say is also that there are country cards at the end of the report. So you don't need to read the entire report because it's almost 200 pages, but there are country cards that summarize in just 3 pages the current situation of breast cancer care in each country, and also gives policy recommendations on how to improve the situation. And if you think that I've been talking a bit, or if you would like to learn more about the report, there is actually a chance very soon to meet both me and also IAPO at the sidelines of the World Health Assembly in Geneva at the end of August. There is an event on the 28th of August to which you're all very much invited, and where we are happy to talk about this report with you. Thank you.
Thank you so much, Thomas. And thank you also for mentioning this event. We'll share further details about this with everyone. And of course, thank you for your presentation. As usual, what I feel about IHE and the way you work, you really provide information in a way that is accessible and easy to grasp. But before you go, I know we are running a little bit late, but I couldn't lose the opportunity to ask you, what do you feel is the value of including experts in this research, and more importantly, patients' view?
That's an excellent question. Thank you, Dani. Well, first of all, I think it's absolutely essential to include local experts in the research. As I said, we're sitting in Sweden, but it's local experts who know what is happening really on the ground. So we are really thankful to all 41 participating experts. And I think it was important also to include a mix of experts, because breast cancer care really requires different roles. So you need the Ministry of Health, of course, which is responsible in an organizational perspective. You need the medical expertise, different kinds of medical specialists, the surgeons, radiologists, medical oncologists. But then we also need the patient voice. And why is the patient voice so important? Well, patients are really the only ones, obviously. They're the only ones who understand the whole process, from experiencing first symptoms to getting a medical appointment to receiving the devastating news that you have breast cancer, and then are the ones that face all the difficulties in the subsequent care process. So it's really only patients that can tell us about the quality of life. aspects such as their impact on well-being, on work life, impact on their families. So to get a full picture, the patient perspective and the patient voice is absolutely essential. And we were so happy also to work together with IAPO and making sure that the patient voice is properly included in the report, in the analysis, as well as the recommendations. Thank you.
Thank you, Thomas. I couldn't agree more. And we will continue to discuss this in the panel discussion that we are going to hold now. So I would like to first thank you, Thomas, for your participation and excellent presentation. And now I would like to invite Dr. Sausan, Ikram, Dr. Reem, and Dr. Giuseppe for our moderated panel discussion. Thank you so much for joining us today. And I would like to start this conversation and invite Dr. Sausan and ask you to share, based on your experience with patient advocacy and women's health in this region, can you share with us some of the challenges that you know and encountered and, of course, came across with regards to that cancer patients face when they interact with the healthcare system in the region?
Thank you very much, Danny, and thank you for inviting me for this important launch. And thank you, Thomas, Dr. Thomas, for the really good summarization of the report. I would say Dr. Thomas actually mentioned a lot of the challenges, especially from a healthcare perspective. He did mention the access issue, the economic burden issue, but I would like to shed more light. One more thing I would like to add is for the people who are watching us from different other countries that the 9 country was the report actually included is based on my experience doing this for the past 20 years. The actual there is a lot of commonality in our region. Now the difference come in each country based, of course, on the culture and the social difference. But in general, you will face the same thing. We will have issue with access to healthcare, not just access to healthcare, access to quality healthcare, which is more important. Also, the fragmented of healthcare. The woman will get diagnosed one place, then she will go to another place to get the treatment, maybe in a third place to get, radiotherapy. And actually, when I was back working in United Arab Emirates, and Friends of Cancer Patients, we used to face that a lot. So again, like what Dr. Thomas mentioned, patient navigation is very important, especially if you're talking in countries where you have huge geographical and large geography, where the main hospital of treatment is maybe actually hours or days away from where the woman is. The other thing that was mentioned that I also agree about is the late diagnosis. And the late diagnosis, it's a very multifactorial aspect, because there is an aspect from the woman herself where she doesn't want to get diagnosed because of the fear of what's going to happen. I'm going to lose my family. I'm going to lose my job. who's going to take care of everybody? And we face that a lot, but also from the healthcare perspective itself, where there is in each country, even in the countries that have proper national programs and really the countries that have that are very limited, that has proper national screening programs for breast cancer. The uptake there is low. Plus the navigation, how the woman, when should she go, how to prompt her to go and do the screening, all this is lacking as well. So it's not just, as I said, it's a multifactorial thing. I think the last one that Dr. Thomas mentioned was the economic burden, but I want to also highlight it's not just the direct cost. As he mentioned, there is lots of now countries are adapting universal health coverage, but still there is a percentage where patient has to pay. So this is the direct cost, but also the indirect cost, which also loss of the job, as the report has mentioned. But also an overall, if you look at the overall picture, is the manpower. Any country that strives for economic stability and economic success needs a healthy community. And the healthy community, we have to start with the prevention and screening, not the late diagnosis, as well as we mentioned earlier. There is one issue, I think, which is very important, which I need to highlight. And this is something I saw not just in United Arab Emirates, but across in our region, is the the cultural, the social, and I think, Danny, you mentioned that in the beginning, the diverse social and cultural aspect in the region, but also the emotional and psychological impact of such a disease. Although breast cancer has been and still number one in our region, but still the acceptability of having a patient diagnosed with breast cancer is really very low and within the community. You still have lots of stigma. You still have lots of shame. You still have lots of that the patient feels. You still have lots of isolation as well that the patient feel, not just from her family but from the society as well. People have lots of misconception when it comes to the disease itself. People still think that the disease is contagious, and I think this is where the awareness campaigns that is driven either by the community or the patient organization is really very important. Again, these kind of the challenges that the patient faces is really although there is a lot of commonality, but again it does differ when you speak and you find that unique voice of the patient on the ground from each country to country. It does you find a lot of, but it definitely goes under the same headings, which is like access, late diagnosis, economic burden, of course, the quality of care as well, and the fragmentation of the healthcare itself.
Thank you, Dr. Sawsan. And I love the fact that you are highlighting the multi-factor of the situation. And we cannot move forward without taking this in consideration. And we now understood a little bit more about the challenges of the patient journey with regards to breast cancer care. And I would love to hear from Ikran about the challenges of advocating for best breast cancer care in the region. As a patient and someone who's on the ground and working with patients, I would love to hear from your experience, Ikram.
Hello, everybody. Thank you for inviting me. Thank you, Danny. Thank you, IAPO, and thank you for all the participants and the audience as well. Now, as I have told you before, I'm a patient. I was diagnosed with the breast cancer in 2019. And that was the first steps towards my journey towards discovering more about breast cancer and especially about advocacy. Now, if I'm going to speak about the challenges, mostly they have been mentioned in the report in the detailed way and some of them were outlined by Thomas and by Dr. Sawsan. But then I will talk from the perspective of a patient organization. And the first challenge I would be mentioning is the lack of data and the lack of information. So by lack of data, it's like documented evidence-based data that we have really found it difficult as patient organizations to collect in terms of updated information about where breast cancer is. In Morocco, for example, we have 2 cancer registries, one regional registries, but we don't have a national one. It's one in Casablanca and one in Rabat. Great efforts are being made to update cancer registries and provide information, but sometimes we do not know if breast cancer, what are the stages at which the breast cancer is diagnosed, if it is in the early stages or our latest stages, and this has very serious implications on our advocacy efforts on the cost of treatments as well, as you know, because treating breast cancer in early stages is not as costly emotionally, socially, and economically as in later stages. Again, one of the important issues that we have is for breast cancer is that our data does not include information about breast cancer recurrences. It means even if we have statistics about how many people are diagnosed with breast cancer, we do not know, we don't have a follow-up about survivorship and follow-up about how of these cases have had recurrences. And this is something very important because, as I said before, early stage breast cancers treatments and protocols differ greatly from metastatic and advanced breast cancer. So lack of data, lack of information, even including myself as a patient, one of the main reasons why I embraced advocacy is that myself, when I was patient, I felt in dire need of information. about breast cancer, about protocols, about side effects. And of course, as the report has mentioned, and Thomas has also said, we lack multidisciplinary teams in the MEA region. And sometimes, even if we have multidisciplinary teams, it's always just the medical side. It means it doesn't include, like Dr. Sousan said, psychosocial support and psychological needs. So you need information, but you don't have anyone to provide you with the information and the support you need. And this is one of the main challenges that we are facing. Another challenge is the lack of the integration of patient voice in our policies and initiatives, especially at the government levels. I think that the WHO is doing a great opportunity, it's given us a great opportunity with the latest framework for meaningful engagement that probably will be dealt with later on. So I'm not going to delve into the detail, but I just want to mention that the patient voice needs to be included. And this has been one of the recommendations of the report, by the way, Thomas will confirm. And it's really hard to imagine how conceptually and at the same time how to operationalize patient engagement. It's not the absence of political willingness, I believe, but sometimes the concept of patient engagement or patient partnership or patient participation is hard to define, and it's harder to operationalize. Another point is the lack of capacity building programs for advocacy organizations. It means as a patient organization in the MEA region, I'm just trying to learn from the experiences of patient organizations that have been working years before myself and learning from their experiences. We would appreciate to have training skills and training programs for advocacy organizations. And I will conclude by the funding, the problems of funding and limited resources for patient organizations throughout I think the MEA region, maybe more in the middle and low middle income countries like Morocco. So that's it. Thank you.
Thank you, Ikram. And thank you so much for giving this really comprehensive overview of the challenges and also touching on this specific point regarding data and information. And that's one of the reasons why this report was developed. And that takes us also to the next question. And I would like to invite Dr. Reen to share with us, based on her experience with the Jordan Breast Cancer Program, which is it's a national program in Jordan. And how do you think this policy report can improve breast cancer care and support decision-making and try to address some or hopefully all of these challenges that have been raised by Dr. Sousan on how patients navigate the system, and Ikram on how the challenges regarding advocacy?
Yeah. First of all, thank you very much, Danny. Thank you, Thomas, and the entire IAPO and IHE team for all your efforts. Congratulations for this, for the launch of this very important report. This report, the way it was, let's say, the methodology it used, the expert it involved, the info it presented, it really provide a credible reference and a credible source of information. Most importantly for decision-making, it will support decision-making and policy-making directly and indirectly. But most importantly, I feel for us as patient advocates, as health advocates, it will serve as an advocacy tool for patient groups, caregivers, healthcare providers. We all can use the report's findings to advocate for better breast cancer care, to raise awareness, and to put bottom-up pressure on policymakers and decision makers to prioritize improvements and to prioritize breast cancer care in general across the entire cycle. Directly, it will inform decision-making and policy-making because this report has identified areas for improvements by analyzing the current situation of breast cancer care across the region, by highlighting areas where access, quality, and specific care options are lacking. This can really inform policy-making on where and how to allocate resources and efforts for breast cancer care. informing policy development by like what Thomas, when he presented the country specific recommendations or country sheets. These sheets, they summarize well the report, direct to the point. So with these data and recommendations, we can use them, or it can be used to develop and implement new policies that address the specific needs in the region. And to consider policies, for example, on screening programs, on treatment protocols, on affordability of care, on mass awareness campaigns. So I think directly and indirectly, it will support policy and decision making. It shared practices and it shared experiences from across the region. And this is, I think, very important and very useful for everyone working on this field. Thank you.
Thank you, Dr. Rin. And you touched on a very important point, which is how it can help with policymakers to improve their work. And that takes us to Dr. Giuseppe and the work that the WHO does, guiding countries across the Eastern Mediterranean region where he's coming from. And of course, guided by the WHO Global Breast Cancer Initiative. So, Dr. Giuseppe, tell us a little bit more. How do you see the report findings supporting this initiative, the implementation of this initiative?
Thank you, Dani, and thank you, Thomas, for the great report, and thank you a lot for having me here. So, to respond to your question, as you know, the goal of the Global Breast Cancer Initiative is to reduce annual breast cancer mortality by 2.5%. Per year, and by addressing the three pillars that Thomas has shared, the pre-diagnostic, diagnostic, and the treatment interval. This is a huge, ambitious goal. Achieving this entails incredible efforts by national authorities, development partners, the UN system, civil society, academia, private sector. And of course, it involves primarily pushing for the mobilization of substantial financial resources, both at the global and the national levels. So the first important strand of this policy report to support the implementation of the GBCI is that it unveils the economic burden of breast cancer. It shows data on direct healthcare costs, which is, let's say, trivial. Governments, they should know, they know. But most importantly, it shows data on the foregone socioeconomic output due to premature mortality, absenteeism, and presenteeism. It shows basically the given up socioeconomic output for not treating these women. It also strengthens the public health argument around early detection and prevention of breast cancer, because it clearly shows that saving women when they are diagnosed at stage 1 or 2, it's much cheaper than treating them when they are at stage 4. In addition to having more chances to save them. And then, of course, it spots the light on specific additional challenges that currently hinder the full implementation of the GBCI. By adopting this systems thinking approach or lens, considering obstacles at the individual and family level, but also at the health system level, from prevention, screening and treatment, to governance, health financing, and referral systems. So these considerations are very important for WHO, which has a convening role because they pave the ground for concerted, multi-sectoral and multi-stakeholder action against breast cancer. And of course, I really like the key recommendations to overcome the challenges, with a specific emphasis on the role of patient organizations and those with lived experience in driving the decision-making process around breast cancer as public health problem. Thank you.
Thank you, Giuseppe. As you talked about this need for a multi-stakeholder effort to address breast cancer, Can you talk a little bit more about what WHO is doing to facilitate the alignment and the action among these various stakeholders to enhance and improve breast cancer care in the region?
Yeah, no, that's a great segue, and thank you. I'm going to talk about 3 points. The first one is around fostering effective governance for cancer control and breast cancer control, of course. The second is enhancing service delivery, so the supply side. And the third is increasing the demand for services. So with regard to effective governance, we work a lot on developing national cancer control strategies or plans. Especially we partner with the International Atomic Energy Agency of the United Nations and with the International Agency on Research for Cancer to conduct comprehensive reviews of the national cancer response in our member states. These are known as impact reviews. These tools not only, inform ministers of health around stakeholders, services, policies, and programs that need to be scaled up or enhanced in terms of cancer control, but they also allow them to reach out to domestic and international donors to increase investments in cancer infrastructure. When it comes to the enhancing service delivery, the supply side, would like everybody know that we have developed a regional investment case on women's cancers. It's coming out soon. It touches upon breast and cervical cancer in this region, the Eastern Mediterranean region. I think the idea at the basis of our investment case and the IAPO policy report is the same. So to provide data on the economic burden of breast cancer, we work on the 22 countries in the WHO EMR. Our methodology not only quantifies the economic value, but also the social value lost due to premature death from breast cancer, which is particularly pertinent in this context where we have a high rate of female unemployment. In addition, the WHO investment case goes beyond the scope of the IAPO's policy report because we also project the cost of breast cancer-related interventions to reach 90% coverage rate of comprehensive cancer treatment. And we calculated the estimated number of lives saved as a result of this, these interventions, as well as the economic return from investing in breast cancer treatment. And we found that if countries scale up WHO recommended interventions, we can save up to 50,000 lives and get between $6 and $8 for each dollar investment. So now we think that this investment case is very important for at least 3 reasons. First of all, it frames spending on breast cancer as an investment rather than a cost. 2, it enables ministries of health and Ministry of Finance to speak the same language, thus facilitating, the negotiation around greater allocation of resources for cancer control. And third is grounded on context-specific data, validated and owned by national authorities. And sorry if I'm taking too long, but this is really important. The last point is the demand side. WHO EMRO is the first WHO region to roll out the WHO framework for meaningful engagement of people living with NCDs with a focus on cancer control, like Ikram was already mentioning earlier. The aim of the framework is to ensure that those with lived experience, patients, survivors, and families are included in the decision-making process around policies and interventions. Nothing about us without us, right? So we aim to generate demand for more and more equitable breast cancer services in the EMR, to begin by identifying patient organizations across 6 countries and by empowering them, by amplifying their voices thanks to WHO's influence on national government. We have already conducted consultations on the ground to explore opportunities and challenges for engaging with people with lived experience that are specific for this region and that include fragile and vulnerable populations such as migrants, refugees, and people living in emergency settings. And our work will also look into developing effective communication messages by involving patients and survivors to address the youth stigma around breast cancer, thus reducing one of the main challenges to seeking care. Thank you.
Thank you, Giuseppe. And thank you for this overview, because not everyone on the ground realizes how much is happening at the regional and global level at the WHO and how much this guides what countries are doing. And it's important for us to always build this parallel and ensure that we recognize these efforts. And I love also that you brought what's happening with regards to the lived experiences, because that links to my next question to Dr. Reen and all the importance. And I would love, Dr. Reen, for you to talk about what needs to happen for patients and communities to have a more active role in breast cancer care decision making, because and throughout all those throughout the entire cancer care cycle, but all those levels of engagement that Giuseppe was talking about, and what patients and the communities can do to improve and make a change, an impactful change on those.
Yes, sure. Yeah, thank you, Danny. So people are the backbone of the health system. So community engagement, patient engagement is really crucial for the success of any healthcare initiative, for any public health program. From our experience, it really allows you to understand, to better understand needs, to build trust with the field, with the community, to increase effectiveness of your interventions and to ensure sustainability. As you mentioned, across all levels, what we need to do with patients and communities to involve them, to inform them, to empower them, and to partner with them across the entire cycle. And this is one of the greatest or the strength point of this report, that it talked about the entire cycle from detection, diagnosis, treatment, and the entire care cycle. How we can do this and what needs to be done better for patients, we need to increase awareness and education. Patients need access to accurate and culturally sensitive information about breast cancer, treatment options, their rights. This really empowers patients to participate in discussions about their care and really to make shared decision making. We need to adopt more patient-centered approach. The entire world is talking about how important to have a patient-centered approach. We need to walk the talk and really to engage patients properly, communicating clearly and encouraging them to express their preferences and to ask questions. Support systems like patient advocacy groups and community support networks, very important. They can play a crucial role in empowering patients and in hearing their voices. For the community itself, in general, I believe, and as was mentioned several times, health and better health outcomes, better well-being does not mean only reaching to a cure. Health is much more than this. And as I mentioned, people are the core to the health system, so they need really to be empowered and heard too. From our experience, it's very important to adopt culturally appropriate outreach, let's say, strategies to tailor messages and communication channels to resonate with different cultures and languages, to provide opportunities for people and for community members and community leaders to be involved in program cycles, implementation and evaluation. and to really do a real and lasting partnerships to collaborate with trusted community organizations, with faith-based groups, and with local media, with local experts, with NGOs working on the ground, always ensuring two-way communication and diverse representation. We really need to hear their voice, to engage them in treatment choices, to engage them in planning, from planning to evaluation in general for all healthcare initiatives. And this will pay back in better health outcomes and more informed patients and community members, and better awareness, as Thomas has mentioned when he talked about detection, and when he talked also about diagnosis. Many of the challenges are really related to the cultural side, or to the community beliefs, fear, stigma, health illiteracy. So really they need to be involved to ensure better outcomes, particularly when it comes to early detection and to prevention. Thank you.
Thank you. That was very inspiring, because you gave us so many different perspectives of how patients can play a more active role in different ways, and to advance their work, and to ensure that breast cancer care is focused on their specific needs and in their specific needs. So I would like we're closing very soon, but we still have a few questions to address. And I would like to invite Dr. Sawson. And I would like to hear from you. What do you think, considering all that we have been discussing up to now? And so in the end, what was the success factors of patient engagement in a policy report as such?
I think that's the main success factor, if any. And I think Dr. Giuseppe said it right when he mentioned nothing for us without us. We cannot call ourselves having a report that tackles multi-stakeholder or patient-centric without having the patient voice, because otherwise that would not be a real true multi-stakeholder approach or patient-centric to start with. And I think one thing that also, everybody articulated so well, during this launch. But I want to also add one thing. I want to add that, and something that Ikram alluded to, is the data. And I think real world data is very important, because the policymakers, at the end of the day, they want real world evidence, not just, evidence based on, reports or surveys. It's real world evidence. Real world evidence will come from actual patient stories, patient journeys that took that journey from A to Z. One more thing as well, that even the way that the economic structuring of healthcare restructuring is happening now is they're basing their healthcare economics based on patient-reported experience as well. So we are moving forward to this era where we are not saying, it's no longer, we are not negotiating should or should we not include patient voice. We are now all on the same page. Patient voice is very important. The only thing is, I love how we shifted the narrative from patient to people living with, because people living with NCDs or other diseases. This is very important for two things. First of all, people living with is more inclusive. It doesn't just mean the patient themselves, but even the caregivers. We almost always forget the caregiver journey with the patient, and I think that is very important. The other thing is, people living with is more also higher when we say, because I have been doing this for 20 years. The word patient became a dirty word. So I think for us to start changing the narrative and saying it's people living with, we forget that those people, or we, are actually us. It's the doctors among us, the advocate among us, the astrophysicists among us, and we have lots of stories that we can share with other people. And we have amazing advocates like Ikram, who I'm so proud of the success that she has been doing. And we have lots of amazing people like Ikram in our region that needs to be highlighted. So these kind of people voices that need to be sit on a round table with policymakers and express that this is how we should, and policymakers should listen, and vice versa. It's a two-way direction. So I think just adding to the real world data is really important, and only it can happen from a patient journey and a patient experience.
I fully agree, Dr. Sawson. Thank you. And Ikram, I would love to hear from you because we talked about all this knowledge that came from the report, the challenges on the ground, the challenges for different stakeholders, what we are doing to, what has been done to address these challenges and can be done as well. And now with all this, I would love to hear from you. How do you see patient organizations making use of all of this and to support their work on the ground and advocate for breast cancer care?
Okay, thank you for your question, which is a very interesting question for all patient organizations. Actually, it's a challenge on how to use reports and materials for advocacy purposes. Now, the first point I want to make is that the report is timely, because in advocacy, we have learned to consider the window of opportunity. I think that breast cancer is gaining a lot of interest given the incidence, the increase in incidence of breast cancer all over the world. And it is timely because we have a lot of initiatives globally about our tackling breast cancer, including the what Dr. Giuseppe talked about GBCI initiatives. And there are also regional initiatives. Some months ago, I think in April 2024, there was a launch of another report by the Lancet, I think, Breast Cancer Commission, which is another report. And this why I say it is an opportunity, because we are like having a lot of data, like Dr. Sampson emphasized, because what needs to have a very good and elaborate advocacy strategy is to have it based on evidence. And I will add to what Dr. Sosan said, is that it's not just evidence, but it is context-based evidence, because we need data from our particular context, because the world has different statistics, different healthcare systems, different insurance operating systems. And so the constraints that you may have in a country or an area of the world would be different. And we are trying all over the world to close the care gap and to start striving for equity. Now, the second point is how the report, I find it's particularly interesting in the form. The way it was designed and structured, there was very clear messages, and advocacy needs to have clear messages. If you want to advocate for something, you need to formulate it in very clear and simple terms. So I found the messages in the recommendations clear and concise, and also compelling and consistent. And this is very important, because when you want to develop an advocacy strategy, you have to select an issue. And the report has given us for each country and for the region on the whole, what are the areas that needs to be improved? What are the main challenges? So we can select issue, we can prioritize the issue, because we need, before planning an action, we need to know if the action is going to be relevant in our context or not, so that it really deserves the investment of time and effort and money that we are going to make and to put into it. So I just want to congratulate the report makers for the methodology, because once it has set my mind to work and given me enlightening ideas about meetings, consultative meetings, when we lack written documents, because the report was done by lit review on the one side, and on the other hand, there was meetings with local experts to collect information. And that's something very useful for patient organizations in the MEA regions to use. It means when we don't have information, we can simply go and ask for meetings with professionals and collect the data that we need in order to form our advocacy plans. Another point is to campaign. Now, campaigning is one very important aspect of advocacy. And I think Dr. Reem has highlighted and underscored the importance of patient voice, patient engagement, and she has given very insightful ideas about how to include patient voice and in systems. and patient education programs, health literacy programs, in screening, for example, because she has mentioned this issue of screening people who are reluctant to go. So I think that the role of advocacy organizations here is much more relevant, and we can have more patient engagement, more community-based actions, especially in awareness programs, breast cancer awareness in general, whether for prevention, whether for detection and early diagnosis, or whether even for treatments, because we know that we have some problems of adherence to treatments, and the role of patient organizations and sharing of patient experiences and successful experiences and stories can be very important in this respect. The main thing, again, from recommendations, it has helped me as a patient organization to start thinking about designing what we call SMART objectives. SMART being the acronym for specific, measurable, achievable, relevant, and timely. So when I take, for example, one recommendation from the list or from the card, I can just transform it into an action plan or into a goal, and then I can design what activities I can use for as an advocacy organization to plan activities. It's important to have these recommendations because it gives us a clear idea of what we as patient organizations can do and what we cannot do. It makes us aware of our privileges and our limitations. I just give an example. For example, when you talk about maybe the role of patient organizations in awareness campaigns, that's something that we can take part in. We can enhance patient engagement, like Dr. Sosan said. But when we talk about training healthcare professionals or regulatory approval of novel therapies, this is something as patient organizations we can only lobby for and advocate for, but we cannot interfere in certain actions directly. So that's another good point of the report. Another point is to build effective partnerships to support our advocacy efforts. While reading the reports, I learned about very good experiences like the women health initiatives maybe in Egypt and other initiatives that were successful. So it's like giving me ideas about where to seek help and learn from each other's gains, complement each other's shortcomings, and just capitalize on the advantages that have already duplicate experiences that have been already successful in other words. And partnerships here, we can talk about different types of partnerships, from the less structured partnerships like networks to a more structured or formal partnerships like the Alliance. Okay, we hope to join the Alliance soon, and the coalitions and so on. And it has also given me ideas about fundraising. It means where to seek fundraising, how to collaborate maybe with governmental institutions, maybe with the pharmaceutical industry to have, for example, if we are trying to find a campaign, awareness campaign, it means it gives ideas about what other stakeholders to engage. And the last point I'm going to mention is specific actions that I could get from the reports that could be directly targeted by patient organizations like support groups and psychosocial support. So this is something that we already, I believe that, and maybe Dr. Reem, Dr. Sausan know that patient organizations are already doing. So maybe we could take the idea that these campaigns should not be limited to October and, for example, specific events, but should be done over all over the year. And to conclude, I will just say that the report is a very good opportunity for us as patient organization to get information first, to get data, and to get ideas about possible actions and possible stakeholders to collaborate with. So I believe that it is a call to action. Even if it is a report, we congratulate all the team. We congratulate ourselves on having this report because it will be very much useful. But at the same time, I think that it is just a beginning, but it is an excellent beginning because what we need to achieve is sustained advocacy. And it is only through sustained advocacy that we can achieve long-term solutions, improve patient outcomes, and improve cancer care all over the world. Thank you.
Thank you, Ikram. That was so inspiring. And I would love to say a big, huge thank you for all of you for joining us in this moderated panel discussion. Thomas, Dr. Sossan, Giuseppe, Ikram, Reem. Wow, I've learned so much from you. And what I like about these opportunities for us to exchange ideas. And because we all are coming from different expertise, knowledges, regions, and I think this fruitful exchange of ideas and experiences, that's what will really help us to continue on this advocacy journey, building on what Ikram just mentioned. And that takes me to a great, I'm very proud to announce that it is a journey. It's not stopping here. Today was a big landmark for us, the launch of this policy report, which you can be found on IAPO's and IHE's website. However, we are already working on the next phase, how we can support patient organizations on the ground to use these findings and enhance and improve the advocacy work, the amazing advocacy work that they are already doing. So we are working on an advocacy and communications toolkit, and we'll be in touch with everyone soon to communicate more on this initiative. And just wanted to highlight that we got a few questions from the audience, and some of these I can quickly answer because it links to the next phases of this project. And just to answer your queries, yes, this is a journey. We will continue to work together to advocate. For the moment, we are just working on this region, but we are, of course, thinking of expanding the work to other regions. IAPO, it's a global organization. This regional initiative is part of a global initiative. And IAPO is here to facilitate and help the connections for us to work together and aligned to advance and reach what in that case we are expecting to reach, which is breast cancer, improvements in breast cancer care. And before I end, I would like to say a huge thank you to the speakers, but also to the attendees here today. I recognize many names. It was great to see you making comments and see you here with us today. Of course, I would like to thank again our sponsors, AstraZeneca, Lilly, MSD, Novartis, and Pfizer, and the experts. Yeah, I couldn't be happier for all that we have achieved so far, and I look forward to continue this collaboration with you all. After this webinar, we'll send everyone the recording so you can revisit it if you want. We'll also send more information about these next steps, the advocacy toolkits that we are building, and also about the event that Thomas briefly mentioned, which will be held at the World Health Assembly in May about women's cancer. Thank you all for joining us today. It was a big pleasure, and I hope to see you all again soon. Bye-bye.
Thank you.